I want to talk now about part of our commitment to reduce the number of lives lost to COVID. We directed the Department of Health and our healthcare providers to prioritize people with developmental disabilities and severe medical conditions for vaccination. So that has been ongoing for the last several weeks. Our county boards of developmental disabilities, in partnership with local health departments, and I want to point out, partnership with our children's hospitals, have worked over the last 3 weeks to identify, to schedule, transport, and vaccinate this high-risk group of individuals. We want to go, even though they're not 65, but these are people who have a very high risk if they get COVID, extremely high risk. And so this effort has been ongoing, and it's been ongoing specifically with people with developmental disabilities for the last 3 weeks. Through this effort, we've heard incredible stories of local collaboration, the incredible planning that has gone into assisting people in getting access to this vaccine. Today, we believe approximately 12,000 individuals who come under this category have been vaccinated. And so we're very happy about that. We're going to continue our work to work with our local partners, our local developmental disability boards, to make sure that the rest of the people in this group are in fact contacted, and those who want the vaccine do in fact receive the vaccines. There's a work in progress, not done. People are still eligible in this group, but we've got 12,000. Now, next week, Ohioans who have certain conditions, the same conditions we talked about, certain conditions they're born with, or those that were diagnosed in childhood and carried into adulthood, will be able to begin receiving COVID-19 vaccines. Again, even though they're not 65. Individuals with these conditions face significantly higher risk for adverse COVID-19 outcomes. We've listed these conditions before, but as we approach the first day when individuals who qualify can get a shot, and that will be next Monday, we thought it would be good for Dr. Vanderhoff to explain these conditions in more detail and explain how individuals who qualify can get a shot. And let me explain again the rationale. We've identified, doctors have identified, approximately 200,000 people in this state who are under the age of 65, who have a very high risk of adverse result if in fact they get COVID. It is a prescribed list. And so we would ask you take a look at that list. It's the same list we've been presenting. We tried to make it clearer, particularly for patients. So when you look at that today, I think you'll find it's a little easier to read, a little easier to understand